So actually, given that this is a new way of interacting with your patients and your stakeholders as part of your digital front door strategy, how much do you think, the bot experience is going to be playing a role with the use cases you're working on? And, could you talk us through some of your current use cases?
Absolutely. So, a nice, vast array of different use cases that we're both exploring and have plans to execute on. The COVID chatbot, for instance, is underway in terms of us developing both a personality and a name and just creating this virtual agent that our patients will hopefully get more familiar with and also have some fun with it, right? It's a chatbot at the end of the day, which how cool is that? So um, the plans there is obviously to expand on what we currently have. We've got the COVID self-checker. We've got some links in there that are pushing patients to local community resources, which, plays a little bit in our social determinants of health. But I think a big one and one that we're really excited about is our primary care scheduling use case. So the idea is that if a patient needs to schedule an appointment, they can quickly hop on St. Luke's website and you're, greeted there by the chatbot, the assistant who quickly wants to help you do whatever you need to accomplish while visiting our website. And then the patient themselves will be able to direct and manage the scheduling of their own visit. I think, most of us as consumers can agree that when you can kind of take over some of that control, it makes it a little bit easier. So that's one thing that we're working on. We've also started another use case around our help desk. So I'm sure that many can relate to, having to call the help desk whenever you need to reset your password or something's not working the way that you want it to. And, historically and as it stands today, that is a very manual task. So somebody calls obviously answered, there's a ticket placed, the ticket has to route to the appropriate team. The team is then identified, somebody has to step away from what they may be doing to reset a password. So there's a lot of excitement around that one as well. So we're automating that password reset, which, oh my goodness, I'm excited to see the numbers around that in terms of time and value